If you're over 50, you might be one of the many people who check their blood pressure at home regularly. It's a smart thing to do, especially as we age and want to keep a close eye on our heart health. But tell me if this sounds familiar. You sit down, wrap the cuff on your arm, press the start button, and then hold your breath while you watch the numbers climb up and up. When you see a high number, you might feel a sudden spike of worry, thinking your heart is in trouble. But here is the comforting truth. Often, that high number isn't because your blood pressure is actually that high, it's because the monitor was set up wrong. Today, I'm going to share 5 simple rules that may help you get the most accurate reading possible so you can stop worrying about false numbers and start trusting your device again. We'll go step by step and I'll give you easier options if you need them. Hello, my friend, and welcome back. I'm Dr. Sarah Truman. Before we dive into today's important topic, I want to be very clear about something important. I'm a health coach and wellness educator. I am not a medical doctor, and this video is not medical advice. Everything I share today is for general educational purposes only. Please talk to your own doctor or healthcare provider before changing how you monitor your blood pressure, adjusting your medications, or making any changes to your health routine. Your doctor knows your personal situation best, and nothing I say here replaces their guidance. Monitoring blood pressure is a vital part of managing heart health, but it needs to be done correctly. So, what are we talking about today? We are talking about accuracy. If you have a home blood pressure monitor, you want to know that the numbers you see are real and reliable. Many seniors feel anxious when they see a high reading, and that anxiety can actually raise their blood pressure even more, creating a frustrating cycle. By learning these 5 simple rules, you may find that your numbers are better than you thought, or that you simply have a clearer picture of what is actually going on inside your body. Here is what we will cover today. First, I'll explain why accuracy matters and what happens in our bodies as we age that affects blood pressure. Second, I'll share the first rule about preparing your body for the reading. Third, we'll go over the second rule, which is all about how you sit and where you place your arm. Fourth, I'll explain the third rule regarding the size of your cuff and why it matters so much. Fifth, we will cover the 4th and 5th rules, which involve your bladder and the timing of your medications. After that, I'll address some common mistakes people make that can mess up their results. And finally, I'll let you know when high blood pressure requires immediate medical attention. Let's get started. Why does this matter so much? Well, blood pressure is essentially a measurement of how hard your heart is working to pump blood through your arteries. Think of your arteries like garden hoses. If the pressure inside the hose is too high, it can put extra strain on the pump, in this case your heart. And over time, it can wear out the hose, which are your blood vessels. This is why we pay so much attention to it as we get older. As we age, our arteries naturally lose some of their flexibility. They can become a bit stiffer, almost like an old rubber band that doesn't stretch as easily as it used to. This natural change means that our blood pressure tends to creep up a little bit. It's a normal part of aging, but it's something we want to keep an eye on. Monitoring at home is wonderful because it gives your doctor a look at what your blood pressure is doing in your normal, everyday life, not just when you are sitting in a quiet doctor's office. However, home monitors are very sensitive. They are designed to pick up even the slightest changes in pressure. Because they are so sensitive, small things like sitting with your legs crossed or having a full bladder or talking while the machine is running can cause the numbers to jump up significantly. This leads to a situation called white coat hypertension in a doctor's office or false hypertension at home. You get a high reading that isn't a true reflection of your baseline health. This is very common. You are not alone in this. Many of my friends and clients have brought me their logs with high numbers only to find out they were measuring right after drinking coffee or right after carrying groceries in. The good news is, small changes to your routine can often make a noticeable difference in the accuracy of your reading. Once you know the rules, you can feel much more confident in the numbers you see. So let's dive into the first rule. The first rule that may help you get an accurate reading is the 5-minute quiet time rule. This is the one most people skip. We are busy, we sit down, strap the cuff on, and push start immediately. but your body needs time to transition from activity to rest. Here is why this helps. If you just walked up the stairs, carried in a heavy bag, or even had a stressful phone call, your heart is beating a little faster and your blood vessels are constricted, which raises your pressure. It takes time for your body to register that it is safe to relax. Here is how to do it. First, go to the bathroom if you need to. We will talk more about why that matters later. Next, sit in your favorite comfortable chair. Make sure it is a spot where you can stay still for a few minutes. Third, simply sit there. Don't look at your phone, don't watch the news, and don't talk to anyone. Just sit quietly. Close your eyes if it helps. Fourth, take some slow, deep breaths. Breathe in slowly through your nose, hold it for a second, and breathe out slowly through your mouth. Do this for about 5 minutes. After 5 minutes, then you can wrap the cuff around your arm and start the machine. This gives your heart rate a chance to settle down and your blood vessels a chance to relax, often resulting in a lower, more accurate reading. Now, here is a safety note. If you feel dizzy or lightheaded when you stand up to get the monitor, please stand up very slowly. You might want to keep the monitor right next to your chair so you don't have to move around much before sitting back down. Take your time. There is no rush. Even a small effort to be still for 5 minutes can really pay off with a more reliable number. Now that we've covered the importance of rest, let's move on to the second rule, which is all about your body position. This is arguably the most important rule of all, yet it is where most mistakes happen. The rule is simple. Sit correctly with your arms supported at heart level. Here is why this helps. Blood pressure is a measurement of fluid pressure. Just like water in a pipe, gravity affects it. If your arm is hanging down by your side, gravity pulls the blood down, which makes the machine have to pump harder to get through your arm, resulting in a falsely high reading. If your arm is raised above your head, gravity works the other way, and you might get a falsely low reading. We want that cuff to be right in line with your heart. Here are your step-by-step instructions. First, sit in a chair that supports your back. Avoid slouching on a sofa or a soft chair where you lean back too much. You want to be upright. Second, place both feet flat on the floor. Do not cross your legs. Crossing your legs actually compresses the veins in your legs and can raise your blood pressure. Third, rest your arm on a flat surface, like a table or the arm of the chair, so that your upper arm is level with your chest. You might need to use a pillow or a stack of books under your arm to prop it up to the right height. Fourth, keep your palm facing upward and your arm relaxed and slightly bent. Make sure the cuff is wrapped snugly around your bare skin, about an inch above your elbow crease. A common mistake here is letting the arm hang down or tensing up the muscles in the arm while the reading is being taken. Make sure your arm is completely relaxed, like a wet noodle. If you are having trouble finding a table at the right height, ask a family member to help you find a setup that works or look for a chair with adjustable armrests. Safety modifications. If you have trouble balancing or getting in and out of chairs, use a sturdy chair with armrests. You can even do this reading while sitting in a wheelchair or a walker seat, as long as you can get your feet flat and your arms supported on a table. If you cannot find a table, you can use a pillow on your lap to bring your arm up closer to heart level, though a table is usually best. Listen to your body. If a position feels uncomfortable, stop and adjust. Okay, take your time getting set up. It might feel like you are being picky, but these small details make a big difference in the accuracy of your reading. Let's move on to the third rule, which is one that is often overlooked. Check your cuff size. Many people use the cuff that comes in the box with the machine and never think about it again. But cuffs are not one size fits all. Using the wrong size cuff is one of the biggest reasons for inaccurate readings. Here is why this helps. The cuff needs to be just the right size to squeeze your arm properly. If the cuff is too small, it has to squeeze really tight to get a reading, which can make your blood pressure look much higher than it actually is. Think of it like wearing shoes that are too small. Your feet feel tight and pressured. Conversely, if the cuff is too big, it might not squeeze enough, giving you a reading that is falsely low. We want the Goldilocks zone just right. Here is how to check it. First, look at the label on your cuff. It usually has a range printed on it, like 22 to 32 centimeters. Second, take a flexible tape measure and wrap it around your upper arm, halfway between your shoulder and your elbow. Third, measure the circumference of your arm. Fourth, compare your measurement to the range on the cuff. If your arm is bigger than the largest number on the cuff is too small for you. If your arm is smaller than the smallest number, the cuff is too big. If you find that your cuff is the wrong size, don't worry. You can usually buy replacement cuffs online or at the pharmacy. Just make sure you buy one that is compatible with your specific brand of monitor. Many seniors find that as they lose or gain weight, or simply due to changes in muscle tone over the years, their arm size changes, so it's good to check this every once in a while. A safety note here. When you wrap the cuff, make sure it is snug but not tight. You should be able to slip one finger underneath the bottom of the cuff easily. If it's digging into your skin, it's too tight. If it's sliding around, it's too loose. Also, make sure the tubing runs down the inside of your arm in line with your middle finger. Usually there is an arrow on the cuff showing where it should go. Don't be discouraged if you need a different size. Getting the right fit is an act of self-care. It ensures you are getting the true information you need to care for your heart. Now, let's talk about the fourth and fifth rules, which go hand in hand. These are about what you do before the reading. Rule 4 is the empty bladder rule, and Rule 5 is about avoiding certain substances beforehand. These might seem surprising, but they can really affect your numbers. Let's start with the empty bladder rule. Research suggests that having a full bladder can temporarily raise your blood pressure. It sounds strange, but your body has to work to manage that fluid, and it can put pressure on nearby organs, which can cause a spike in your reading. Some studies show it can raise systolic pressure, the top number, by 10 to 15 points. That's a big difference. So, the rule is simple. Always use the bathroom before you take your reading. Now, the fifth rule is avoiding stimulants. This includes caffeine, nicotine, and certain foods for at least 30 minutes before measuring. Caffeine is a stimulant that causes a temporary but sharp spike in blood pressure. If you love your morning coffee or tea, that's perfectly fine, but try to measure your blood pressure before you drink it or wait at least 30 minutes until after. Similarly, if you smoke, avoid doing so for at least 30 minutes before measuring. Smoking constricts your blood vessels and raises your blood pressure immediately. This rule is also a great opportunity to talk to your doctor about quitting if you still smoke, as that is one of the best things you can for your heart health. Another thing to avoid is exercise. If you've just gone for a walk, done your stretches, or vacuumed the living room, wait at least 30 minutes before measuring. Exercise raises your blood pressure temporarily to pump blood to your muscles, which is healthy, but it will give you a false high reading if you measure right away. Safety modifications. If you take medications, especially those for blood pressure, ask your doctor when you should measure. Some doctors prefer you measure before taking your medication, while others prefer after. It's important to follow your doctor's specific instructions, and if you take a diuretic, often called a water pill, that empty bladder rule is even more important because those medications work by helping your body get rid of excess fluid. Now let's talk about some common mistakes and myths that I see often. The first mistake is talking during the reading. I know you might want to ask your spouse what the number is or answer the phone, but talking actually activates your muscles and changes your breathing, which can raise your blood pressure. From the moment you press start until the machine beeps and gives you the number, remain completely silent. Don't even talk to the machine. The second mistake is wrapping the cuff over clothing. It is very tempting to just pull up your sleeve and put the cuff over it, especially if it's cold. But clothing, especially thick fabrics like sweatshirts or fleece, acts like padding and prevents the cuff from squeezing your arm properly. This almost always leads to a reading that is higher than your actual blood pressure. Always place the cuff directly on your bare skin. The third myth is that the higher your blood pressure, the more you should worry. While high blood pressure is serious, stress and worry can actually raise it further. We want to approach this calmly. The monitor is a tool for information, not a judge of your character. If you get a high reading, stay calm, wait 5 minutes, and measure again. If it is still high, record it and share it with your doctor. You are doing the right thing by monitoring. Now, let's talk about when to see a doctor or seek immediate help. While home monitoring is great for managing your day-to-day health, there are times when you need professional help right away. Please see your doctor or seek medical attention if your top number, the systolic pressure, is consistently higher than 180, or if your bottom number, the diastolic pressure, is consistently higher than 120. This is considered a hypertensive crisis. If you have these numbers along with symptoms like a severe headache, chest pain, shortness of breath, back pain, numbness or weakness in your face or arm, difficulty speaking, or vision changes, please call emergency services immediately. Do not wait to see if it goes down. Also, please see your doctor if you experience dizziness, lightheadedness, or fainting spells. Sometimes this can happen if your blood pressure drops too low, especially if you are on medication. It's important to find the right balance so your blood pressure isn't too high or too low. And finally, always see your doctor if you notice a sudden, significant change in your readings compared to what is normal for you. Your doctor can adjust your treatment plan or help you troubleshoot your monitoring technique. Trust your instincts. If something doesn't feel right, it's always better to get it checked. Let's quickly recap what we covered today. First, we talked about the 5-minute quiet time rule, giving your body time to rest before measuring. Second, we covered the importance of proper positioning, specifically keeping your feet flat, your back supported, and your arm at heart level. Third, we discussed checking your cuff size to make sure it fits your arm properly. Fourth, we learned to use the bathroom before measuring to avoid the pressure of a full bladder. And fifth, we covered avoiding stimulants like caffeine, nicotine, and exercise for 30 minutes beforehand. Remember, you don't have to do everything at once. Start with one small change that feels manageable. Maybe just focusing on sitting still for 5 minutes is the best place to start. Once that becomes a habit, add in checking your cuff size or ensuring your arm is on the table. Small steps add up over time. Be patient and kind with yourself. It takes a little practice to get into a new routine, but your heart is worth the effort. If you found this helpful, I'd be so grateful if you'd give this video a thumbs up. It helps other seniors find this information too, and that means a lot to me. And if you're not subscribed yet, consider joining our community. I share new videos every week to help you stay strong, healthy, and independent as you age. If you'd like to keep going, I recommend watching this video next. Heart Healthy Habits for Seniors Over 50. I'll put the link on screen and in the description. It's a great companion to today's topic because it focuses on lifestyle habits that may support healthy blood pressure in the long run. Thank you so much for spending this time with me today. Taking control of your health at home is a wonderful step, and I'm so glad you are here with me. Take care of yourself, and I'll see you in the next video.